Hi, everybody. I'm Dr. Brian Ardis. This is the Dr. Ardis Show, and this entire podcast is what to do about celiac disease. And is there any hope for people who are sensitive to gluten anytime they eat it or have rashes on their body, autoimmune diseases they've been diagnosed with? If you know somebody who has been diagnosed with celiac, if you yourself struggle to consume gluten in your food, which is a very dense protein found in a lot of grains. If you know anybody struggling with celiac, this show is for them. So please share this with them, because what you're told by the medical profession is there's no cure for them. There's nothing that can be done, when in fact, researchers and medical science papers all around the world have already confirmed there are many things you can do to improve the likelihood of people having worse symptoms with celiac disease, improving their gluten reaction so they don't react to it anymore. And I'm going to show you all the research. What has been published by medical science is the known cure and those things that people can supplement to improve gluten sensitivity and ultimately reverse their celiac disease. And can it be reversed? You better believe it. Does the medical profession believe it? No, they don't. So we're going to teach you what it is the medical profession says about celiac disease, and then what the Dr. Ardis Show and what our research that we put together for you says about celiac disease, and the hope for all of you, the millions around the world suffering with celiac. This show's for you. I have a PowerPoint presentation. We're going to take you through it right now so you can see the highlighted research statements and promises and hope found in medical research to beat celiac symptoms. It's going to be amazing. I hope you love it. Remember, you go to the resources tab of the drardisshow.com and download this entire PowerPoint for free. You just go in there and download it. It's a PDF, and you can go share it with anybody you know who has celiac, so they can see the research and learn themselves of the hope that lies within the presentations we give you here at the Dr. Ardis Show. So let's dive in. Everything you need to know about celiac. All right, reversing celiac and gluten sensitivity. Let's see what the research says. First, this is a QR code. Scan it, put in your email. We will notify you when our next presentation is ready. Once a week, I actually dive into a health topic of some sort, interview a guest, talk about a health scenario or a medical diagnosis, and what is the truth about the hope that lies within nature's healing principles. That's what this QR code is for. If you want to be notified, put in your email when you scan that code, and you'll be notified each week of our free podcast that we do. All right, let's start with Celiac Disease Foundation. They might know something about celiac. What is celiac disease? Well, they write that celiac disease is a serious autoimmune disease that occurs in genetically predisposed people, which I think everybody has genes inside of them, where the ingestion of gluten leads to damage in the small intestine. It's estimated to affect 1 in 100 people worldwide, but they state only about 30% of people are accurately diagnosed and properly diagnosed to have celiac. So what they're saying is 70% of people with celiac issues and gluten sensitivity, they don't even know they have this problem. So what is celiac disease per the Celiac Disease Foundation? When people with celiac disease eat gluten, a protein found in wheat, rye, and barley, their body mounts an immune response that attacks the small intestine. These attacks lead to damage on the villi. These are small finger-like projections that line the small intestine that promote nutrient absorption from the food you eat. When the villi, these little finger-like projections, get damaged, nutrients cannot be absorbed properly into the body. Therefore, what would be the complication? You become nutritionally deficient, and you will develop every symptom and disease on earth. Now let's go to medstarhealth.com.org. What do they state about celiac disease? Well, they show you the pictures of those little villi in your small intestine. This is when people have celiac disease and are gluten sensitive. They describe it here and what those little villi look like. This is how they describe celiac disease. It is an autoimmune disorder that can develop at any point in life, from infancy to adulthood. It's different from gluten intolerance, celiac disease is, which is a sensitivity to foods with gluten. Celiac disease and gluten intolerance symptoms may both involve digestive discomfort, such as bloating or diarrhea. However, gluten sensitivity won't cause your body to attack itself, they say. That's the difference between celiac and gluten. Gluten, you might just react to gluten. Celiac, you have an autoimmune response. Your body is literally killing cells in the intestines. Penn State, University of Pennsylvania, Penn Medicine, they published their definition of celiac disease. Celiac disease is a autoimmune condition that damages the lining of the small intestine. This damage comes from a reaction to eating gluten, they say. Pretty uniform what the definition of celiac disease is. The treatment per University of Penn Medicine. Celiac disease cannot be cured. Wow. So the medical profession still cannot cure you of celiac disease. Your symptoms will go away, and the villi in the intestines, those little finger-like projections, will heal, they say, if you follow a lifelong gluten-free diet. Now, I'm not saying it's a bad idea. I'm just telling you what Penn Medicine is saying. The only way to fix this is to avoid gluten the rest of your life. This is the Mayo Clinic. What's the Mayo Clinic say about celiac disease? They got plenty to say too. So let's dive into what they want you to know. With refractory celiac disease, the small intestine doesn't heal, they say. Refractory celiac disease can be quite serious, and there is currently no proven treatment for celiac disease. Just want to reinforce what the Mayo Clinic and what the Cleveland Clinic and what everybody's telling you. So also what you should know, celiac.org has published this 20 things you need to know about celiac disease. So if you have celiac, you will know these things. If you are supporting someone you know or love that has celiac disease, this is what they're suffering with. This is last updated 2022. So let's read together. 1 in 100 people worldwide have celiac disease. The next thing, celiac disease affects an estimated 3 million Americans. So this podcast needs to be watched by 3 million people. Approximately 60 to 70% of Americans with celiac disease are not diagnosed and are needlessly suffering, they state. More children have celiac disease than Crohn's disease, ulcerative colitis, and cystic fibrosis combined. There's a lot of grandkids, a lot of nieces and nephews out there, a lot of children of yours that may suffer with gluten sensitivity. This podcast is for them. Celiac disease can affect every organ in your body. I bet you all thought it was just a small intestine disease. Approximately half of diagnosed patients still report symptoms while on a gluten-free diet. So even if you only avoid gluten, as has been recommended by medical associations I just showed you, the only way to beat it is a lifelong gluten-free sensitivity diet. Did you know that even if you live gluten-free, 50% of all people with this disease will still have gluten symptoms? There's an average delay of 6 to 10 years for an accurate celiac disease diagnosis. From the time you start having symptoms, it's going to take them 6 to 10 years on average to diagnose you accurately. It's a long time. Without a timely diagnosis, celiac disease can lead to intestinal cancers, type 1 diabetes, osteoporosis, thyroid disease, multiple sclerosis, anemia, infertility and miscarriage, epilepsy, seizures, and more. There's more than 200 symptoms associated with celiac disease, they report. The later the age of celiac disease diagnosis, the greater the chance of developing another autoimmune disease. People with celiac disease have an increased incidence of microscopic colitis, inflammation of their stomach, and inflammatory bowel disease, Crohn's disease, and ulcerative colitis. People recently diagnosed with celiac disease are commonly deficient in these things. Take note, those who have celiac disease and have been diagnosed with it after their 6 to 10 years of suffering, they often have a deficiency in fiber, a deficiency in iron, a deficiency in calcium, a deficiency in magnesium, a deficiency in zinc, a deficiency in folate, which is vitamin B9, a deficiency in niacin, which is vitamin B3, deficiency in riboflavin, which is vitamin B2, a deficiency in vitamin B12, and vitamin D. Well, before I even continue with this presentation, you now know what it is your people with celiac disease should be supplementing. They should be supplementing iron, calcium, magnesium, zinc, folate, niacin, riboflavin, vitamin B12, and vitamin D. All of these are found in bee pollen, by the way. They're also in my Doc's Healthy Kids supplement, just so you know. All of those are in it. So there's a basic starting point. This is Salon Editorial, salon.com. Celiac disease numbers keep going up. Yet, due to lack of funding, researchers still aren't sure why. Okay, this is awesome. When I read this title, I was like, oh my God, how ridiculous is this? So researchers have still not figured out why celiac is affecting millions of people around the world. And they're blaming it on a lack of funding to do the research. Okay, I just have to tell you guys, billions of dollars has been spent researching celiac, and there's still no understanding about what causes it or how to cure it. And these medical establishments like the Mayo Clinic, gastroenterology associations, the Foundation for Celiac, they're still telling you there is no cure. There's already been billions of dollars funded into research. That's not the reason. They're not looking for the cause. At the Dr. Ardis show, I can tell you what's causing it. Everybody I've ever seen that had celiac disease all had parasites, just so you know, in their intestines. And it took 2 to 3 months to clear it all out and then restore them back to health. Now, they say there is no cure to celiac disease. This is what the medical profession is going to tell you. So what are the prescribed medications that they're going to prescribe everybody who has celiacs? Outside of telling you just avoid gluten foods, what's the drugs they prescribe? Well, there's a list. Let's go through them. This is the Celiac Disease Foundation. They state there's only a lifelong adherence to the gluten-free diet. This is the only treatment for celiac disease. That's what they tell you. This means avoiding foods and beverages that have gluten, which is a protein found in wheat, rye, and barley. Just so you know. So let's go to what is the options for those. If you go to the Advanced Functional Medicine website, advancedfunctionalmedicine.com, the negative side effects of a gluten-free diet. So even if you do live the gluten-free diet, what are the downsides? Well, there are some. Would you like to know what they are? You may not be getting all the nutrients you need. This is the first possible named negative effect of a gluten-free diet. Enriched wheat flour products are a good source of iron and B vitamins. But when you avoid gluten foods, you're not going to get iron and B vitamins. And I just showed you the research study claiming that fiber, vitamin B6, B12, B3, B2 are all deficient. And iron is found deficient in those that are on gluten-free diets. It may disrupt your gut microbiome when you go just gluten-free. Just so you know, wheat is a good source of prebiotics, which are essential for gut health. They're making sure you're aware of. A gluten-free diet may lead to a fat gain, just so you know. All of you who go on a fat-free diet, those of you with lupus, developing celiacs, all of you will put on weight. And it's usually because you go gluten-free. Recent studies they announce here on advancedfunctionalmedicine.com. A gluten-free diet may lead to fat gain. They state recent studies show an association between people who are on a fat, gluten-free diet and weight gain, and subsequently the risk of cardiovascular disease and type 2 diabetes on a gluten-free diet. There's a high acellular carb content, lots of carbs in gluten-free replacement foods that may cause excess weight gain. The Mayo Clinic, celiac disease, they published medications that can control intestinal inflammation. If your small intestine is severely damaged or you have refractory celiac disease, steroids may be recommended to control inflammation. Other drugs they mentioned at the bottom, such as azathioprine, Asazin, or Imurin, which are the brand names, or budesonide, which is a corticosteroid inhaler, might be used to help people with celiacs. Well, let's go over budesonide's published risks. So this is from drugs.com. Those of you who have celiacs, if your loved one or gluten intolerant, have been prescribed budesonide as an inhaler or as a nebulized agent. I just need you to be aware, these are some of the side effects of budesonide. You should know what these are. If you take budesonide, it has a published very common side effect to cause respiratory infections in up to 13% of everybody that takes budesonide. So if you've been diagnosed with a lifelong condition called celiac, if you've been recommended budesonide, 1 in 10 of you at least will develop respiratory infections from the drug called budesonide. Also read that 10% of you, 1 in 10, will also develop nasopharyngitis, nasal congestion, pharyngitis, allergic rhinitis, runny nose, viral upper respiratory infections, cough, hoarseness. Those are just published. 1 in 10 are going to develop this. These are common side effects of budesonide, which is a steroid. Also, they published that 1 in 10% of all people will develop a moon face or decreased blood cortisol. And we're just showing you what that looks like, adrenal insufficiency. You see the actress on the right. You see her with adrenal insufficiency, causing a moon face on the left, and what it looks like afterwards, what it's supposed to look like without the moon face. It is reported, I want to highlight this under the picture, that death occurred due to adrenal insufficiency because of budesonide. 1 in 10 people will also develop oral candida, which if you look at the bottom left image, yellow fungus growing on your tongue as a result of budesonide. Next time you're going on a blind date and they want to kiss you, you might want to ask them if they're on budesonide and if they got that yellow, nasty tongue. All right, some of the other published side effects of budesonide, the most common are 21% of all people, 1 in 5 will develop abdominal pain. 13% of them will develop nausea and want to throw up. 1 to 10% will develop viral gastroenteritis, intestinal virus symptoms. Look at all those symptoms. When you got celiac disease, you're already worried about your bowels. Look at the whole list of bowel symptoms that 1 in 10 people will experience on budesonide. 28%, that's 1 in 3 of all people to prescribe budesonide for celiac disease will develop headaches like migraines. And you won't even know it's being caused by the drug you're being prescribed. 1 in 10 will develop urinary tract infections. It's not bad to have bowel issues and bloating and diarrhea from celiacs and gluten. Let's add urinary tract infection symptoms to the mix. 1 in 10 will develop that. Did you know 1 in 10 people on budesonide will develop mood changes, sleep changes, and insomnia? Psychosis has also been published to be a serious side effect of budesonide. Depression, aggressive reactions, mood swings. Did you know it's very common that you'll have muscle spasms that are involuntary in 1 in 10 people on budesonide? And take a picture, take a look at the image in the bottom right-hand corner. Cardiovascular risks, very common. Budesonide causes peripheral edema in 1 in 5 people. You'll get edema, swelling of your legs and arms and hands. And then high blood pressure in 1 in 10, 12%. Ask your doctor if high blood pressure and pitting edema are right for you when they prescribe budesonide. And then for those with celiac disease, if you're put on budesonide, 1 in 10 will develop conjunctivitis, which is pink eye. 1 in 10 will develop acne that they don't want. 1 in 10 will develop eczema and contact dermatitis, which is a rash and itchiness all over the body. Not sure that's better than just having celiacs. So what's the alternative? If it's just steroids and budesonide they can offer you and a gluten-free diet, let's look at things that they have published can help to improve gastrointestinal disorders, including celiac disease. And we're going to start with black cumin seed oil, otherwise known as Nigella sativa, which is the first ingredient in our biodefense product. We introduced biodefense to help the E. coli bacteria, Enterobacter bacteria, and yeast issues and shedding of the Nigella sativa oil is also published to improve celiac disease, which is the first ingredient in biodefense. How exciting is that? Also, biodefense ingredients are also published to be a cure for the bird flu, which is why we are very excited about this product. Not only for COVID vaccine and those worried about being shed on. If you've been vaccinated for COVID, you should be on biodefense. If you're worried about the bird flu, you should have biodefense in your medicine cabinet. If you have psoriasis, you should be using biodefense to cure yourself as an antidote. If you have celiac disease, you're about to learn why it is you should be on biodefense orally. 2 capsules full. A dropper fits into 1 capsule, empty vegetable capsule. I don't recommend swallowing this in your mouth. It tastes gross. These plant extracts are potent. But let's learn what Nigella sativa oil does for gastrointestinal diseases. Increasingly used as a spice in kitchens around the world, black cumin seed oil, due to its immunomodulatory properties, its immune system supportive properties, has potential applications in the prevention and treatment of many conditions accompanied by chronic inflammation, of which celiac disease is one. There is ample evidence of black cumin seed oil having anti-inflammatory, anti-parasitic, cholagogic, whatever that is. I actually looked that up. I've never seen this word before. I looked it up. Cholagogic, that means moving bile out of your liver into your gallbladder and into your intestines. Hepatoprotective means liver protective, and anti-ulcer effects. So if you have ulcers, intestinal ulcers, black cumin seed oil and biodefense are right for you too. Positive effects from its use, black cumin seed oil, were also observed regarding improving lipid profile, which is cholesterol, and body composition parameters, losing weight, shrinking your waistline, in patients with type 2 diabetes and liver steatosis, such as body weight and waist circumference, making it useful for the specific prevention of metabolic syndrome. Metabolic syndrome, if you remember, is 3 categories of symptoms: an increased waist circumference, increased high blood pressure, and increased blood lipid profile, increase in cholesterol. Therefore, they mention here, it seems reasonable to include this ingredient in the diet as an element of therapy supporting the treatment process, including drug treatment for celiacs and gastrointestinal disorders. These are the studies in which black cumin seed oil was used. And I just want to highlight out of this research study what else black cumin seed oil has been published to help fix. For the stomach, those with acid reflux and acid reflux disease. Did you know that black cumin seed oil, found in Biodefense, first ingredient, has been published to reduce gastric acid secretion? So that can help you with GERD symptoms, gastroesophageal reflux disease. Enhancement in ulcer healing, decreasing in white blood cell invasion. It's also a potential anti-H. pylori properties in humans, so it can help to reverse gastrointestinal diseases created by H. pylori bacteria. It's also been shown in type 2 diabetics, Nigella sativa oil has anti-cholesterol levels. It helps to bring down high cholesterol levels. And it lowers blood sugar levels. It's hypoglycemic effects, which is amazing. It's also been published in studies to help reverse pancreatic cancer. Several mechanisms underlying apoptosis of pancreatic cancer cells were described regarding thymoquinone inside of black cumin seed oil. That's what the TQ stands for. The liver, the second research study down there below, it also, black cumin seed oil, increased the levels of antioxidant enzymes, decreasing liver enzymes in your blood work of AST, ALT, and ALP. Also lowers lipid peroxidase, which is great. It lowers body weight, lowers inflammation markers in the body. Black cumin seed oil has also been established to help with hepatitis C viral load by reducing hepatitis C viral load and inhibiting its replication. It's also been found in the intestines to overall support, improve both the enzymes, non-enzyme parameters, and antioxidant defenses of the intestinal mucosa, which is directly correlated in celiac disease. It's increased intestinal glutathione stimulating hormone, and carolase levels were observed with black seed oil supplementation. Gut healing natural resources role in the management of celiac disease. This is the next research article. Black cumin seed oil, otherwise known as Nigella sativa oil, belongs to the Ramiculaceae family, is used for medicinal purpose to treat many kinds of illnesses. The anti-inflammatory benefit of black cumin seed oil is anti-diabetic, anti-pyretic, antimicrobial, anti-gastroprotective, anti-H. pylori activity, and immune system modulating activities, along with a very low degree of toxicity of black seed extracts, have been demonstrated in lots of clinical and experimental studies. Not a few, in a lot. A study with the aim of assessing the validity of black cumin seed oil in the treatment of celiac disease patients who are resistant or unresponsive to a strict gluten-free diet and show malabsorbed symptoms and villus atrophy, those little villi all shrunk and died, despite at least 6 to 12 months of dieting. So those following a gluten-free diet for 6 months to 12 months who don't see improvement in any of their symptoms, they found that administering black cumin seed oil with a gluten-free diet had immune system effects on celiac disease better than gluten-free diet alone. And it led to complete disease recovery and significant decrease of blood markers. Black cumin seed oil with gluten-free diet had all of the benefits to reverse celiac disease. Osman and co-workers in another study found that the treatment of adults with iron deficiency anemia caused by celiac disease with black seed oil added to their gluten-free diet for a period of 12 months was more effective than a gluten-free diet alone in the disease process, immune process, and histology improvement. Meaning when they took a biopsy of the intestines, their entire cellular health of their intestines improved just adding black cumin seed oil to their gluten-free diet. So all of you with celiac disease, you might want to add Biodefense to your everyday gluten-free diet because it's already been proven in science to improve every measure of the celiac disease process. It's immune system markers in the blood, hematological, that's the blood, immunological, that's the immune system and autoimmune markers, and then the histology, the disease process of the intestines were improved in all facets. Celiac disease was improved if they just supplemented black cumin seed oil along with gluten-free diets. 12 months. He and his colleagues in another study on dermatitis as an autoimmune skin disorder caused by celiac disease, which is treated by lifelong strict gluten-free diet adherence, found that adding black cumin seed oil capsules to a gluten-free diet for a period of 6 months enhanced the efficacy of the gluten-free diet in the treatment of the disease of dermatitis, leading to complete clinical duodenal, that's intestines, and skin disease remission, and the absence of blood autoimmune markers called serological antibodies. Black cumin seed oil with a gluten-free diet helped to resolve all the markers you find in the blood, and the skin, and the intestines to diagnose someone with celiac disease. Isn't that exciting? Ask your doctor if biodefense and black cumin seed oil are right for you, because it is. Here is right out of the research study. I just want to highlight this. It is not only black cumin seed oil, but I'm just telling you, this biodefense product is amazing at reversing autoimmune diseases, skin conditions, and intestinal issues where there is a microbiome issue. And in celiac disease, there's massive amounts of issues: joint pain, inflammation, rashes, all kinds of stuff come up as a result of being gluten intolerant. As you can read on the screen, we're going to go down the list. You see in red, black cumin seed oil has been found to have a mechanism of action against inflammation, parasites, microbes, tumors, gastrointestinal inflammation, anti-H. pylori. It's also benefits the immune system. It's also a known antioxidant, and it improves nitric oxide production to help reverse autoimmune diseases. Also on this list for celiac disease, it's already been studied and proven that green tea at the top improves celiac disease symptoms. Cocoa also has these beneficial impacts on celiac disease. You can read them there. Curcumin. I would recommend Global Healing's curcumin. I don't just have an isolated curcumin product, but if you have celiac, I would recommend curcumin from Global Healing, along with our biodefense product that has black cumin seed oil. You'll also see echinacea in the research studies they found with that one. That plant also has improved celiac disease outcomes. In this same study reference where I just showed you that table of the various plant extracts improving celiac disease, I want to highlight this. Among celiac disease patients in the United States, it has been reported that of 423 patients, 100 of them, which is 23%, especially who had symptoms at diagnosis, used dietary supplements like probiotics, fish oil, peppermint, and turmeric to control their celiac disease symptoms. And 336 of those patients, 79% of them, agreed with the medical profession's support for complementary and alternative medicine. I need you to be aware that a quarter of all patients with celiac disease, when they're studying them, they are finding benefits from complementary alternative therapies, which we are including here and highlighting for you. Black cumin seed oil, echinacea, curcumin, you name it. Those things I just highlighted. Vitamin D has been studied. Many research studies have been done on vitamin D levels in celiac disease. And you should know that there is a direct correlation to the severity of celiac, your gluten sensitivity, and how much vitamin D is in your blood. That has already been confirmed over and over. In support of the involvement of vitamin D in the autoimmune aspect of celiac disease, scientific data shows that other autoimmune diseases are positively affected by vitamin D, and decreased vitamin D concentrations have been reported in many autoimmune diseases, such as multiple sclerosis, type 1 diabetes, rheumatoid arthritis, fibromyalgia, and systemic lupus erythematosus. The autoimmune disease aspects of celiac disease can be regulated by vitamin D. But that's not what the Mayo Clinic told you. They said there is no cure. There's no way to treat celiac disease, only with a gluten-free diet. Did you know that aspects of celiac disease can be regulated by vitamin D? It induces the development of DCs, dendritic cells, with tolerogenic phenotype. They inhibit alloreactive T cell activation, and it reduces T and B cell responsiveness, eventually leading to the control of autoimmune responses in celiac disease. Vitamin D does. Vitamin D stops all those autoimmune cells from being produced to ultimately reverse the scenario. Isn't that exciting? Did your rheumatologist tell you that? Did your gastroenterologist tell you vitamin D has been directly found to remit celiac disease? Vitamin D regulates homeostasis of the gut mucosa. Did you know all the bacteria and fungi in your gut need vitamin D? By maintaining the integrity of the epithelial barrier and through healing of the epithelium, the lining of the inside of your gut. Vitamin D supports the integrity of the epithelial barrier by increasing expression of what are called VDR associated junction proteins. And they name them for you, such as occludin, claudin, vincelin, and zonula occludins that constitute tight junctions between epithelial cells. Have you ever heard of a leaky gut syndrome? Especially in celiac disease patients? The junctions of the intestines to keep things from getting in your blood supply through your intestinal wall in leaky gut syndrome, you have to keep those junctions tight, and it's of these 4 particular cells that vitamin D has been proven to increase the junction and secure the gut-blood barrier. Vitamin D deficiency leads to an increased susceptibility of the mucosa membrane to damage and significantly increase the risk of intestinal diseases. The gut is one of the tissues in the body that have the most abundant VDR expression, indicating that it is a major physiological target for vitamin D supplementation. In conclusion, sufficient experimental data are available to support the concept that a bidirectional relationship exists between celiac disease and vitamin D status, and that low level of vitamin D negatively impacts the clinical prognosis of the disease. The lower their vitamin D level goes in the blood, the worse their symptoms are of celiac disease. Maintaining optimal levels of vitamin D may have a favorable impact both on the skeleton and on the outcome of celiac disease itself, end quote. Celiac disease and severe vitamin D deficiency. Here's another research study. The current cross-sectional study aimed to see if severe vitamin D deficiency is associated with celiac disease patients among Saudi Arabian adolescent girls. A total of 200 adolescent females aged 13 to 19 years old with vitamin D deficiency of less than 50 nanomoles were screened for an antibody called IgA-TTG, anti-tissue transglutaminase antibodies, and they want to know, do they have these antibodies inside of them, and is there higher amounts of these antibodies in the group of kids with low vitamin D levels, leading to more gluten sensitivity or celiac disease outcomes. Of the 200 girls, 9 were positive, that's 4.5%, were positive for these IgA-TTG antibodies, all of whom had blood levels of vitamin D lower than 12.5 nanomoles. A strong, significant inverse association was observed between the amount of those antibodies and the blood vitamin D level among the antibody negative participants. Finally, participants with positive antibodies was 37 times higher for participants who had lower vitamin D levels below 12.5 nanomoles. The lower their vitamin D levels were below 12.5, there was a 37 times higher incidence of having celiac autoimmune markers in the blood. The data suggests that celiac disease may be a risk factor for severe vitamin D deficiency, and that patients presenting with very low levels of vitamin D, lower than 12.5 nanomoles, in the absence of an obvious cause, may need to be screened for celiac disease. In fact, they found such a correlation between low levels of vitamin D and celiac disease that they're even telling you, medical doctors, if you even just take their blood and you measure their vitamin D level, if it is lower than 12.5, you should test them for celiac disease. That's how highly correlated vitamin D levels and celiac disease goes. Vitamin and mineral deficiency in children newly diagnosed with celiac disease. This is a research study from 2015. You see the date top left. Vitamin and mineral deficiency in children newly diagnosed with celiac disease. What did they find? They found that in a total of 52 pediatric patients that were diagnosed with celiac disease via blood and intestine biopsy, who fulfilled the study criteria, were enrolled. What did they find? Vitamin D and vitamin A, vitamin E, and zinc and iron deficiencies were determined in 51% of those people with celiac disease in children, 51% were vitamin D deficient, 7% were vitamin A deficient, 13% were vitamin E deficient, and 67% were zinc deficient, and 35% were iron deficient, respectively, at the time of diagnosis. Vitamin D deficiency was observed more frequently in patients with growth retardation at the time of application. Their conclusions stand. Vitamin D, zinc, and iron deficiency are frequently observed in pediatric patients with celiac disease at the time of diagnosis. Researchers conclude blood levels, vitamin D, zinc, and iron levels should be checked in all children diagnosed with celiac disease. Not just checked. If they're low, you should be supplementing them. Iron, zinc, and vitamin D have been observed and found in all children with celiac disease. Zinc deficiency in a separate study from 2023. Zinc deficiency and its therapeutic value of zinc supplementation in pediatric gastrointestinal diseases, including celiac disease. Patients with celiac disease exhibit deficiencies in various vitamins and minerals, including zinc. Research has shown that both untreated and clinically remitted celiac disease patients have reduced blood levels of zinc. Zinc deficiency was documented with a prevalence as high as 67% in newly diagnosed adults with celiac disease. And it can affect zinc deficiency up to 64% of pediatric patients with the same condition. Zinc deficiency was found to correlate with villus atrophy, the little finger-like projections in your intestines. They start dying and retracting with zinc deficiency. A study reported that 60% of patients with partial villus atrophy, so they just shrunk halfway, 80% with subtotal villus atrophy, and 92% with total villus atrophy were deficient in zinc. So if you had any amount of villi that were actually shrinking and dying, you all had zinc deficiency. A narrative review examining celiac disease patients on a long-term gluten-free diet with good compliance over 2 years revealed that micronutrient, little bitty nutrient deficiencies were common, with up to 40% of subjects experiencing zinc deficiency on a gluten-free diet. Children with untreated celiac disease and enteropathy exhibited significantly reduced blood level zinc levels. There is evidence suggesting disrupted zinc homeostasis in celiac disease patients. Additionally, the exchangeable zinc pools in the body that can exchange with blood levels of zinc, was found to be significantly decreased in celiac disease patients. The amount of zinc available in the body was lower in all patients with celiac disease. In a study aimed at determining whether or not blood levels of zinc in 140 samples from 78 children with celiac disease in different phases, abnormally low zinc levels were observed in children with acute celiac disease. The results of the study suggest regular measurement of blood level zinc concentration in children with celiac disease, and that supports that zinc supplementation in patients with reduced zinc levels during a period of 2 to 4 weeks with celiac disease is warranted. Zinc deficiency can be used as an indicator to suggest the diagnosis of celiac disease in children with short stature. Low plasma zinc levels were observed in 54% of cases due to celiac disease they blame. In a study to evaluate the effect of zinc supplementation on blood levels of zinc levels in children with celiac disease, the blood levels of zinc was determined at inclusion of the study, and zinc supplementation was given for 3 months, with zinc levels measured at 3 months and 6 months. The results showed that the blood levels of zinc were significantly lower in celiac disease patients. During the 3 and 6 month follow-ups, the blood levels of zinc among severely malnourished and stunted cases were also significantly lower, irrespective of their treatment status. How long did they take it for? So zinc is an important supplement. Now let's get into all the cures that we just reviewed in the research studies. Number 1 is black cumin seed oil, found in our biodefense product. How do you take it? If you know somebody with celiac disease and you want to benefit from black cumin seed oil, as you see highlighted as the first ingredient in there, you take this, open it, suck up 1 dropper full, and shoot that dropper full into an empty vegetable capsule, close it, put it in your mouth, drink it with some filtered water, take 1 in the morning and 1 in the evening. If you or a loved one has celiac disease, I recommend doing 3 a day until you see improvements in your symptoms, then go down to 2 a day. And then once you see all of your symptoms resolved, go down to 1 a day. Just 1 capsule full a day of biodefense for prevention and management. This is our vitamin D3 product. We just showed you research studies on the vitamin D levels in all patients with celiac disease is lower than 12.5 nanomoles. So we need to get that up. This is 5,000 IUs of our vitamin D3 in a gel cap. You can get that at Nature Wins. This is our Doc's Healthy Kids. The reason why I bring this up is this is our only multivitamin, all naturally sourced vitamin and mineral multivitamin. I just showed you research studies of vitamin D along with zinc and iron have been found to improve celiac outcomes in patients. And all pediatric patients with celiacs have low levels of vitamin A, vitamin E, zinc, and then iron, and a few other things. I just went over those. I just want you to know all of those are in our Doc's Healthy Kids supplements. You can see all of those vitamins and minerals are in our Doc's Healthy Kids. So if you have concerns of a pediatric aged individual with celiac disease and gluten sensitivity, they should be on our supplement, Doc's Healthy Kids. That's why we made it. And it's all organic, all natural. This is our Zinc Plus supplement. We just showed you that zinc deficiencies can lead to celiac disease, worsening symptoms. Zinc Plus has 30 milligrams in 1 capsule. I recommend at least 30 to 50 milligrams of zinc every single day, even those with celiac disease. You can get yours at Nature Wins. Now, all of you with celiac disease, I started out this presentation telling you that every celiac patient I've ever tested in my practice, they all, 100% of them had parasites in their bowels or in their spleen. Best way to figure that out is our full GI panel and bacterial swab, as you see on the screen. This is what I'm holding here is the test kit you'll get in the mail. You submit your stool sample, send it in, mail it into Parasite Centers Incorporated. And within 1 week, you will have in your email the results of all the parasites in your body and which ones you have and where you got exposed to these from, most likely. It's all in the report. And then they will give you guidance of what prescription medications to use for the parasites you have or what antibiotics to use for the bacteria you might have in your body, which comes in a separate report 2 to 3 weeks after you submit your stool sample test. Everybody, you're going to ship in the stool sample test with your poop sample in it. Within 1 week, you're going to get an emailed report of all your parasites. You're going to get a second report in your email 2 to 3 weeks after mailing this kit that has all your bacteria and yeast findings. And it will give you your recommendations there, prescription-wise and all natural too. It doesn't matter what you test for. Everybody, if you test positive for any bacteria, yeast, or parasites with this stool sample kit, the first thing I'm going to recommend is biodefense, morning and evening, every day at a minimum, or 3 times a day. Also, you're going to see the Freedom Cleanse Restore Parasite Treatment Kit will be recommended for anybody who has any of those things show up positive also. That is our Parasite Treatment Kit, 3 supplements called Freedom, Cleanse, and Restore, which is a collection of all organic plants to rid the body of parasites, bacteria, and yeast, and replace them with healthy probiotics and prebiotics. And then don't forget our biodefense product. And then I recommend for everybody, if you have celiac disease, you should do this stool sample test. I recommend, see which bugs you have in your body, maybe you're responsible for your inflammation and autoimmune disease and your diagnosis. Start taking your supplements as I recommended them in this podcast. You're going to do the stool sample test first. Then you're going to take your products for 3 months. After 3 months, you're going to stop taking all of the supplements that I'm recommending in this show. And you're going to stop them for 2 weeks and then redo the stool sample test. And you want to see if taking the supplements for 3 months was enough to kill the bacteria, yeast, or parasites in your body, possibly causing your celiac symptoms. If they're all gone in your stool sample test, you don't need to keep doing the biodefense, the Freedom Cleanse Restore products, the vitamin D3, the zinc, unless you just want to make sure you're getting adequate amounts of those every day in your diet, which I do recommend. But if you did that stool sample test 3 months later and you find you still have any of these bugs, let's say you had parasites, E. coli bacteria, and yeast, and for 3 months you took my recommendations and you did the stool sample test again and you still just had parasites, but the bacteria is all gone, the candida is all gone, the yeast, all that died, you still need to treat the parasites. So I would stay on the Freedom Cleanse Restore for another 3 months and biodefense for another 3 months. And it wouldn't matter if you still had E. coli bacteria or if you had yeast, it doesn't matter. I would recommend just another 3 months of treatment and redo the stool sample test until they're all gone. You should see improvement in all of your bloating, celiac disease symptoms, and anytime you eat gluten after doing this for 3 months. And I can't wait to find out if this presentation of what we have discovered through research are published antidotes and relief for your symptoms of celiac disease. Then this presentation on how to improve celiac all naturally was a win for me, and I'm so thrilled and honored to be able to spend time with you today. I hope you learned something. Remember, you can go to the resources tab at the Dr. Ardis Show and download this PowerPoint for free. If you know anybody struggling with celiac and you can't remember all the recommendations and all the research we just showed, go download the PDF and send it to anybody you know or love who's struggling with celiac themselves. It wouldn't hurt giving anybody these recommendations for 3 to 6 months if we can improve their living experience and their diet experience around foods. Our goal is to reduce the burden of stress, symptoms, worry, fear, and anxiety around eating foods that may have gluten in them. And we just showed you research studies, multiple of them over the last 30 years, that they've been able to show that certain foods, certain minerals, certain vitamins actually improve all celiac outcomes. I'm Dr. Ardis. This is the Dr. Ardis Show, and may you and your loved ones struggling with celiac benefit from this presentation. God bless.
Disclaimer. Please note, the following presentation is solely for informational purposes and should not be seen as a replacement for advice provided by your physician. It is important not to rely on the information from this presentation for diagnosis, treatment, medication prescription, or any other form of medical care. Always consult with your physician or healthcare professionals before taking any medication, nutritional supplement, herbal remedy, homeopathic treatment, or pursuing any health-related procedure. If you have a medical condition or believe you might have one, promptly contact your healthcare provider. Do not disregard professional medical advice or delay seeking it based on this presentation's information as the products or services purchased from it do not establish a doctor-patient relationship between you and any affiliated physicians. Statements about dietary supplements have not been evaluated by the Food and Drug Administration and are not intended to diagnose, treat, cure, or prevent any disease.